My name is Luisa Hasanet Meraz, and this is my skills checkoff video for NG tube insertion and removal. Hello, good morning. My name is Luisa Meraz. I'm a student at Royal College, and today I'll be inserting your nasogastric tube. Can I please have your full name and date of birth? Okay. I'm gonna compare to my order, and I'm also gonna check your bracelet. Okay. Now I have here your order for an NG tube that's gonna go from your nose to your stomach, and this provides nutrients to your GI. If you have impaired swallowing or cannot take food through orally, this is the best way to get your nutrients in. Now I will proceed to asking you if you have any nasal trauma, recent bleeding, any history of concerning your nasal area. Okay, you don't have any. Perfect. Now I will continue to place you in a high Fowler's position, and okay, so now I'm gonna put a pillow on your back. Perfect. And also I'm gonna put a drape on your chest. Perfect. Now I'm gonna perform hand hygiene. And put a pair of clean gloves. Now I have my clean gloves on. I have my open package here. I'm gonna measure the length of the NG tube by starting the tip of the nose of the patient to the earlobe to the sigmoid process. I'm gonna feel for the sigmoid process, which is around here. So that's when I'm gonna measure the NG tube. To the earlobe and to the sigmoid process. Just from here. So nose, earlobe, process. Okay, double checking. And I'm gonna place some tape to measure the length. Okay, now that I have that done, I'm gonna grab my pen light and I'm gonna assess the patient's nares. Okay, now I will ask the patient to exhale to assess patency. After that, I'm gonna start communicating to my patient that she might feel some discomfort during the process, but if she has any significant discomfort, to please raise her finger up. I would also tell the patient once she starts feeling the NG tube in her throat, to please tilt her head to her chest a little bit, and also to start swallowing water, which I'm going to provide here. I'm going to place it here to the patient. Once they feel it, to start swallowing so the tube can go down easier. And as the patient is swallowing, I'll be inserting the tube further. If the patient starts gagging, if there is any resistance, I'm going to stop and I'm going to pull back a little, not completely. Wait till the patient to relax and then continue again. Okay. I will perform hand hygiene and put on a pair of clean gloves. First, I'll start by applying lubricant in the first 4 inches of the tube. Now that my 4 inches are lubricated, I'm ready for insertion. I will do it slowly. As I repeat myself, checking for gagging, choking, and coughing. If the patient is presenting those signs, I'm gonna pull back a little bit and wait for my patient to relax and continue advancing. I'm also advancing as my patient is swallowing water for comfort. And okay, once I get to the tape mark, I'm gonna grab a pen, a permanent marker, which I have here, and put a mark there to assess for the location of the tube and if it has been moved, and to also just to assess placement. Okay, I'm gonna put my marker back. I'm finished marking the tube with a marker for to assess placement later on. I'm also gonna assess placement by inspecting the mouth to see that the tube is in the back of the throat of the patient, the breath sounds and gushing sound in the left upper quadrant, and also I'm gonna assess by checking the pH level. So first, I'm gonna start by assessing the mouth. Okay, I see the tube in the back of the throat. Now I'm gonna assess my breath sounds. Okay, breath sounds are normal. Now I'm gonna assess the left upper quadrant, and I'm gonna insert 30 ml of air. Okay, I hear the gushing sound. Now I'm gonna remove my stethoscope, place it on the table, and I'm gonna aspirate 5 to 10 ml of gastric aspirate to check the pH level. Normally, then I'm gonna clamp. Normally the pH should be from 0 to 4. 0 to 4 inches. I'm gonna clamp and place it here in the patient's drape. Okay, now I'm gonna grab a container here. Okay, I'm gonna grab my container, push the aspirate, place it back on the tray, and then I'm gonna check for pH level. The color of the gastric aspirate should be either clear off-white color or green. So this is a green color, and the pH is within limit, which is 0 to 4. Okay, after that I'm gonna, okay, so I see that the patient's tube is in the correct placement. I already checked the gushing sound and the pH, and the tube marking is still there. And now I'm gonna put some skin prep around the patient's nose, and I'm also gonna apply some tape there. Okay. After that, I'm also gonna secure here with, I'm gonna secure, I'm gonna take off the drape, and I'm gonna secure it to the patient's gown. I'm going to secure the tube. And I will remove this and place it in the trash. Okay, I perform hand hygiene. Ask the patient how they're feeling, if they're feeling any discomfort. I would tell the patient that their head has to be within 30 or higher degrees. So I'm gonna place the patient in a mid Fowler's to high Fowler's position, put the patient as the lowest position, ask if they want me to remove their water. Okay, I'm gonna remove the water, and I'm also telling the patient to call me if there's any discomfort, any pain, to please let me know how we can assist. If there are any other concerns, I would step off. Okay, so now I'm going to be demonstrating how to remove an empty tube. First, I'll start by checking my order, my patient. I'm going to ask them for their name and full date of birth. I'm going to check my order, check that I have the correct patient, and the order for removal. Now that I have done that, I'm going to perform hand hygiene. Put on a pair of clean gloves, and I'm going to start removing the tape that's securing here in the nostril, and also removing the tape from the gown, placing it in the trash. Then I'm going to put a drape over the patient. Okay, and I'm also going to provide some facial tissues. I'm going to put them in the patient's hand so they can clean themselves. After that, I'm going to ask the patient to hold their breath, and as I'm removing it, steadily controlling the tube. Okay, so I'm gonna start removing it. Before I started removing, if the patient had some suction, I would turn it off. My patient didn't have any suction, so that's why I didn't do it. But if he or she were to have suction, I will turn off the suction before I remove the tube. Now that the tube has been removed, I will place it here in my trash, and I'm also gonna help the patient to clean up. Remove any dirty facial tissues, taking them in my trash, and now I'm gonna grab my stethoscope and assess for lung sounds. Okay, the lung sounds are normal, breath sounds are normal. Now I'm gonna grab my pen light and assess once again the nostrils to see that they don't have any irritation or inflammation. Okay, lastly, I would ask the patient if they're feeling any discomfort in their nose, throat, or GI. If it's not, then I'm gonna place the bed at its lowest position and place the call light within reach of the patient so they can call me if they have any concerns or if they start feeling any pain. I'm gonna remove my gloves and perform hand hygiene. My last step would be documenting on my EHR the client's response, the type of tube, the size of the tube, the technique used, and also whether the amount and characteristics of the drainage. In this case, my patient had green drainage, which is normal, and the pH was within limits, which is 0 to 4. Thank you.